So at this point, it's appropriate to invite Dr. David Greenwald to come up to respond and also add his comments because he's the incoming president for the American College of Gastroenterology, the ACG, another major GI group, and he is director of clinical gastroenterology and endoscopy at Mount Sinai Hospital and professor of medicine at the medical school there. Dr. Greenwald.
Thanks. I will tell you, that this actually, hi John. While they're doing that, I would just say that this worked out very nicely. So we weren't sure if John was going to be able to make it here. So I actually put together some stuff just like that. John, you did an amazing job. And I want to just cover like 2 or 3 more things to sort of round it out. So the grade methodology and the way that guidelines are produced is really, really important. But this meeting is incredibly important. And it's really incredibly important because I'm hoping that it will lead to this white paper and it will lead to guidelines. And that's really the way that all of this is going to go from sort of the data and the theory to the real practice. So the guidelines from GI societies in the case of something like this are a way in the United States that we can translate all the information that you're taking here and get them out to the boots on the ground, the people who are actually doing the testing, so we can get the H. pylori testing done, that we can get the endoscopy done in the right populations at the right time and really make an impact. And we've been able to do that in a lot of different arenas in gastroenterology because we've had effective guidelines. So, I did a guidelines talk at a national meeting recently, and the bottom line on the whole thing was that, I just said guidelines are good. And they're really, really good. And let's see, I think this is, there you are. Listen, you invited me here. Nice of you to invite me here. Thanks. Just be careful. So, I come from New York, but Juha's from California. And so here's Juha and his regular, he moved from Seattle where it's kind of cold and yucky, but now he's in California, so he's got his convertible and he's driving around. But you always got to be careful what you wish for because in his convertible, where he's really happy, he's about to get to a bridge, 2 outhouses, and you know how that story ends, right? Just be careful there, Juha. All right, so I agree with everything that John said. I would say that symposia, how can professional societies help address health disparities? The way to do it is through a combination of symposia, committees, and then advocacy. Everybody up here talked about advocacy. It's really, really important. So symposia like this must have a work output. So having a white paper that actually follows this is really important because that's then going to get to development of guidelines and be able to push societies to create guidelines, which is great. Commissioned articles in peer-reviewed journals basically work the same way. The committees in the various GI societies and other medical societies also create work and output that's prioritized by the agendas that are out there and the society leadership, and they can help push the agendas forward. So things like this, meetings like this, which were done in the past for colorectal cancer as an example, turn out to be really, really important. Advocacy is really critical as well. So, here's Howard. Howard's everywhere, okay? But he turned out to be an incredible advocate for the colorectal cancer screening movement in the United States. The gentleman on the right of him is Ron Vender. Ron was a previous ACG president. Howard and Ron have a longstanding friendship that I think goes back to college, right? Medical school? Medical school. And when Ron was president, Howard and Ron were talking about something that Ron could do to help the GI community, and it turned out to be colorectal cancer, and he turned out to be an unbelievable advocate for us, leading an 80% by 2018 campaign where we raised the screening rate for colorectal cancer in this country from the mid 40% to now in the upper 60%. So we can get to 80%, but now we're going for 80% in every community. The same thing can happen here in selected populations for gastric cancer, and the GI societies, all 3 GI societies, that all use the same grade methodology to create papers that John was talking about. We all use the same guidelines. This is an example of advocacy from the professional side. So this is the ACG leadership and governors on Capitol Hill doing it. The patient advocates are really strong, though. So Aki, everything that you're doing is perfect. And the patient advocates for going to Washington, lobbying, there are a number of them in the colon cancer world that have made incredible progress. And as Howard said earlier today, the personal stories are just drive the ship all the way. That's really good. There have been some outputs from, in this case, the ASGE Standards of Practice Committee. So this is an example of a committee guideline that looked at race and ethnicity considerations in endoscopy. So this goes back 5 years now, and 2 of the recommendations include endoscopy for surveillance in patients with gastric intestinal metaplasia coupled with an increased risk of gastric cancer because of ethnic background or family history. It's all the stuff that's been coming out today. And again, it's in a committee report, but it hasn't made to sort of the next level practice guideline. And screening endoscopy for gastric cancer may be considered in new U.S. immigrants from high-risk regions around the world, including all the countries you see, especially if there's a family history of gastric cancer in the first-degree relative. So a lot of the stuff that Shel Jashal was talking about this morning as a cost-effective way to go, is sitting in here. So the societies can definitely help move these things along. The ASGE Membership and Diversity Committee in 2016, just published a report that said diversity in gastroenterology in the United States. Where are we now? Where should we go? I won't go through the details with you, but there are similar ACG and AGA papers that look exactly like this. So, the initial question that Juha posed was, are we ready to establish guidelines for gastric cancer screening in the United States? And I would argue, I hope so. I think we definitely should be doing that. There's so much compelling evidence that I've heard this morning. Chinher comparing the need for gastric cancer screening favorably to colorectal cancer screening, which is already accepted in almost every population. I mean, that chart you showed was very, very compelling. So, yeah, that's it. Thanks.